I'm Dr. Lily Mundy, and today I'm talking about a recent article that's being published in PRS titled Parenting in Plastic Surgery Residency. The goal of this study is to better understand the experience of having children during residency for plastic surgery residents. Plastic surgery residency, which typically ranges 3 to 7 years depending on the training program, is how physicians or doctors who are graduating from medical school train to become plastic surgeons. This training typically occurs during common childbearing ages, making this a really important area of research. And this area of study is quite near and dear to my heart, as I had 2 children during residency with a spouse who had a full-time job, so I can truly relate to many of the experiences presented here in this research. The authors surveyed current plastic surgery residents across the country, asking them about current childcare accommodations, options available to them at their training institution, and the experience surrounding raising children during residency. The authors found that childcare needs during residency create a large financial burden for residents. And residency programs are not currently meeting the childcare needs of residents with children and providing options for on-site childcare. Residents with children are primarily relying on the use of a nanny, which leads to childcare costs that are 3 times the national average for daycare. However, given the 24-hour nature of clinical care in the hospital, most residents have found that they also need childcare options that extend beyond a typical daycare hours. While this study has some really important findings, in critically evaluating it, it's also important to think about the limitations. And the limitations of this study are primarily centered around it is a small survey study that had a very low response rate. The authors surveyed around 1,000 plastic surgery residents across the country. However, only 32 residents responded, and of this, only 12 of those residents had children. With such a low response rate at 3%, it is possible that these results wouldn't hold true if the remaining 97% of residents who were surveyed had responded. However, what is really great about this study is that it highlights a really important issue for many plastic surgery residents, and that is how to best integrate this thing that's really important to many people, having a family, into another really important thing in that resident's life, which is how to learn to be the best surgeon they're able to be, to take really good care of patients, and to be a good team member to the other surgeons that they're working with. This study helps to further that discussion of balancing these needs at the national level and may spark discussion within residency programs and individual hospitals that could lead to real change with the goal of a tangible benefit to both current and future residents. Lastly, this may help address another really important issue, which is gender equality in plastic surgery. The authors identified that parents who were female residents were more likely than parents who were male residents to miss work for childcare reasons. This suggests that limitations in affordable and reliable childcare impacts female residents significantly more than it impacts male residents, and addressing these issues may be another way to help close the gender gap in plastic surgery. Overall, really excellent work to the authors on such an important topic, and bravo to PRS in bringing attention to this issue and continuing the discussion in search for really sustainable solutions.